Let's talk about back pain today. Not that annoying twinge of pain after you deadlift or that soreness you get after doing your heavy intensity workouts or running. We're talking about the back pain that stops you in your tracks, that fiery pain that you can't shake. It's hard to sleep, hard to roll over in bed. You can't sit down, you can't put on your pants. Playing with your kids on the ground, out of the question. What I want to do is show you 3 techniques that you can use to help start that resolution of pain. All this is just putting that fire out. The back pain's bad, you can't stretch, you can't move. This is where you're going to start. All right, so the first thing we want to do is understand why there's back pain. The back pain is there maybe because of injury, maybe because of pain, but back pain perseverates a lot of times because we get stuck on it and then we think about it and then we tighten. We think about it some more and we tighten some more. So at a certain point, we're just this bundle of stress and nerves that's just locked into place. So the first thing I have people do is work on some breathing to relax the trunk muscles, relax the hip, relax the chest. So however you can do it, whether it's sitting, laying down, standing, leaning over your counter, it doesn't really matter, but all we're going to focus on is relaxing this area of your body. We don't want to tighten, we don't want to tense, we just want to relax everything. So the way we're going to do this is by doing some breathing, specifically abdominal breathing. So think about your belly moving in and out. We don't want to just move the chest because that's where your lungs are, but that's not where the lungs expand. But that's one of the places where the lungs expand. But we also have the diaphragm that pushes down. So when you're breathing in, I want you to take a deep breath in through your belly. Try to push it as far out as you can. And then when you breathe out, just think about relaxing everything down. Use this as your meditation. Try to do 5-10 seconds breathing in, 5-10 seconds breathing out. As you go through this, try to increase the amount of time that you're doing it. The goal, again, is not to improve your breathing mechanics. It's not to strengthen your abdominal muscles. The sole purpose of this is just to relax. So that's what I want you to do. So breathing in, breathing out. The best place to do this is a nice, dark, quiet room. If you have kids, if they're running around, just do the best that you can to try to relax. So technique number 1, just breathe, try to relax, try to let the tension out of your body. So the next thing I want to talk about is hip mobility. Typically when we're talking about back, I like to talk about thoracic mobility, the upper trunk, and hip mobility. But a lot of times when our back pain is so painful, we can't mobilize the upper back because when we try to move the upper back, the low back moves and picks out some of that irritation. So all we're going to do is look at the hips today. The first way to do this, we're going to look at the back pocket muscle, the posterior lateral hip. All you're going to do is sitting down if you can, and you're going to cross your leg over. If you can't get all the way in this position, modify it however you can. I know getting into this position is tough sometimes, so use your hands if you need to, and remember from the first step, try to relax your back. All you're going to do is just sit here. Go back to that first step, do some of the deep abdominal breathing. When you're ready and you think that you're able to, roll a little bit forward on your hips and you should feel a little bit more of a stretch in the back of the hip. Now we're not going for this huge, amazing, pain relieving stretch. What we're trying to do is just feel a little bit of something. The first step with irritating, high, fiery back pain is just to calm everything down. We're not looking for 100% resolution. We're looking for 10%. We're looking for 5%. We're looking for something that will get you down that path so you can get back to your mobility and your workouts and all that other stuff that you know works. So when you can, holding onto your leg, just push down a little bit on your knee and you'll feel a little bit more of a stretch. The other alternative to that is the same exact starting position. All you're going to do is just give your knee a little bit of a hug. And you should feel the stretch in a similar location, but it should be a little bit different. You're going to find which one you like. I know when I was going through my episode of low back pain 7 years ago, this was the first thing that started giving me relief. So sitting up, if you can sit up nice and tall, pushing the knee down, feel that back of the hip stretch, and then bringing the knee up. So as much as you can, as little as you want, it really doesn't matter. We just want to get some movement into the system so the low back doesn't take all of that force. So step 1, we got to relax. The way we can do that is abdominal breathing. Step number 2, let's get that posterior lateral hip mobilized. Start dropping that tension down. Step number 3 is going to be the anterior hip. This one's going to be tough because a lot of times when we're sitting for a living, this gets really tight. When we want to stand up straight, the back just arches. When the back arches, when we're in this amount of pain, it's not going to feel good. So what we want to do is try to get the stretch on the front of the muscle without activating the low back. So the easiest way to do that is just a basic runner stretch. The nice thing about this is you can still hold on, bring one leg back, and if you kind of pivot your hip and twist around, you can start to get a little bit of a stretch. If this hurts your back, bend forward a little bit, and you can still get that. You can try to get in the angle that mobilizes that hip the best. So even right there, I'm feeling a stretch in the front of my hip. I can bend my back if it's starting to bother my back, or if it feels better to straighten, I can do that, and I can still feel that stretch in the hip. So again, these three movements, we have breathing to relax. We have crossing your leg to get the posterior lateral part of the hip, and we have that standing modified runner stretch. These should give you some relief. Sometimes we need a little bit more, so that's when heat, ice, pain medication, that stuff works really well. We have a place for it, and this is the time for it. Once you're able to stretch and once you're able to move, the hips will be able to move better. The low back won't have to take as much force. And hopefully this will get you to the point that you're able to do a little bit more higher intensity exercises. So remember, this is only the first step. The first step is to take the fire out. We want to make sure that we decrease the pain. The second step is to fix the underlying cause. If you're in this much pain, there's definitely something going on underneath, whether that's hip mobility, whether that's mid-back mobility, maybe it's just a general lack of conditioning and strength that you have to work on. Definitely hit that stuff. Don't end there. Don't end just because the pain goes away, because it's just going to keep coming back. We want to make sure that we take that second step and fix that underlying cause. But then we don't want pain relief now. We want to plan for that future. We want to make sure that when we're 50, 60, 70, 90, 120 years old, we still have enough strength and power and ability to move around and to be active and control our own body. So make sure that you have that plan for the future. What is that? Once you're feeling good, how are we going to make sure that it stays good forever? Get in a gym, start running, start your mobility program, start yoga, start Pilates. I don't care what you do. We just have to make sure that we have that plan for the future. So as a review, breathing to relax, crossing your leg to stretch the back of the hip, modified runner stretch to stretch the front of the hip. Once you have that down, remember the 3 steps: relieve the pain, fix the underlying cause, plan for the future.